Welcome to our channel, where we dive deep into the world of health and wellness. Today, we're tackling a crucial topic: medicines that can damage your liver. The liver is one of the most vital organs in the body, responsible for detoxifying harmful substances, producing bile for digestion, and regulating various biochemical processes. However, certain medications, even those commonly used, can pose significant risks to liver health if not used properly. Have you ever wondered how everyday drugs like Tylenol can impact your liver? Or what precautions you should take when prescribed medications for chronic conditions? In this video, we'll explore 7 medicines known for their potential to harm the liver, discuss how they cause damage, and share tips on how to use these drugs safely. So if you want to protect your liver while managing your health, keep watching and don't forget to subscribe for more insightful content. On acetaminophen, Tylenol. Acetaminophen, commonly known by the brand name Tylenol, is a popular over-the-counter medication used to relieve pain and reduce fever. However, taking too much acetaminophen can cause severe liver damage. This happens because the liver breaks down acetaminophen into both harmless and harmful substances. When taken in large amounts, the liver can't process the toxic substances quickly enough, leading to their buildup. Signs of an overdose include nausea, vomiting, and stomach pain, which can worsen to yellowing of the skin, jaundice, confusion, and liver failure if not treated promptly. People who drink alcohol regularly are at higher risk because alcohol makes the liver produce more of the enzymes that turn acetaminophen into its toxic form. Even taking acetaminophen at the recommended doses for a long time can put a strain on the liver, especially for those with existing liver problems. Acetaminophen is also an ingredient in many combination medications, which can increase the chance of accidentally taking too much. It's important to keep track of the total amount of acetaminophen taken from all sources to avoid toxicity. The antidote for an acetaminophen overdose is N-acetylcysteine, which works best if given within 8–10 hours after the overdose. Educating patients about safe dosing and the signs of an overdose is crucial. For those who need to use acetaminophen, long-term, regular liver function tests can help catch early signs of liver damage. 2. Methotrexate. Methotrexate is a medication commonly used to treat certain cancers, rheumatoid arthritis, and severe psoriasis. While it can be highly effective, it carries a risk of liver toxicity, especially with long-term use. This medication works by inhibiting an enzyme called dihydrofolate reductase, which is crucial for DNA synthesis and cell replication. This action is beneficial for controlling cancer and autoimmune conditions, but can harm the liver over time. Chronic use of methotrexate can lead to serious liver issues, including fibrosis, scarring of the liver, and cirrhosis, severe liver damage. The risk of liver damage increases with higher doses, prolonged use, and alcohol consumption. Therefore, it is essential for patients on methotrexate to have their liver enzymes monitored regularly to catch any early signs of liver damage. Signs of liver toxicity include fatigue, abdominal pain, dark urine, and jaundice, yellowing of the skin and eyes. Certain groups are at a higher risk of developing liver problems, including those with pre-existing liver conditions, individuals who are obese, and those who consume alcohol. To mitigate some of the toxic effects, folate supplementation is often recommended since methotrexate interferes with folic acid metabolism. For long-term users, regular liver biopsies might be necessary to monitor liver health. It is crucial to avoid alcohol and other hepatotoxic drugs while taking methotrexate. If liver damage is detected early, adjusting the dose or discontinuing the drug can often reverse the damage. However, if the damage is severe, it might lead to irreversible liver failure. 3. Isoniazid. Isoniazid is a key medication used to treat tuberculosis, but it comes with a notable risk of liver toxicity, particularly within the first few months of treatment. This risk is higher in people who metabolize the drug slowly, a process known as acetylation. These slow acetylators are more susceptible to liver damage. Liver toxicity from isoniazid can range from being completely asymptomatic to presenting symptoms such as fatigue, loss of appetite, nausea, and jaundice. Because of this, regular liver function tests are crucial while on isoniazid therapy to catch any signs of hepatotoxicity early. Certain factors increase the risk of liver damage from isoniazid, including age and the consumption of alcohol or other drugs that can harm the liver. Additionally, genetic differences, particularly in the NAT2 gene, influence how isoniazid is metabolized, affecting an individual's risk of developing liver issues. If liver enzyme levels become elevated, stopping isoniazid typically allows for recovery. For some patients, reducing the isoniazid dose may be beneficial, but this requires careful and continuous monitoring. In severe cases of liver damage, a liver biopsy might be necessary to assess the extent of the injury. Or amiodarone. Amiodarone is a powerful medication used to treat serious heart rhythm disorders, arrhythmias. While it's effective for this purpose, it can also cause various liver problems, ranging from mild, symptomless increases in liver enzymes to severe conditions like cirrhosis. Because amiodarone is lipophilic, fat-loving, it tends to accumulate in the liver, potentially causing long-term damage even after you stop taking it. One significant liver-related side effect of chronic amiodarone use is steatohepatitis. This condition involves the buildup of fat in liver cells, accompanied by inflammation, which can further harm the liver. To monitor for these issues, liver function tests are crucial before starting amiodarone and should be done regularly throughout treatment. The risk of such damage increases with higher doses and prolonged use of amiodarone. 5 statins. Statins, which are commonly prescribed to lower cholesterol levels, can sometimes cause liver damage, especially in individuals with pre-existing liver conditions. These medications work by inhibiting an enzyme called HMG-CoA reductase, which plays a key role in cholesterol synthesis. However, this inhibition can also affect liver cell function. A common side effect of statins is an elevation in liver enzymes, which are indicators of liver stress or damage. While severe liver damage is rare, it is important to be aware of the symptoms, which can include fatigue, weakness, and jaundice, a yellowing of the skin and eyes. The risk of liver damage from statins increases with higher doses and prolonged use. To manage this risk, healthcare providers often recommend regular monitoring of liver enzyme levels, especially during the first few months of therapy. If significant elevations in liver enzymes are detected, it may be necessary to adjust the dosage or discontinue the medication. In addition to liver damage, statins can cause muscle damage, which can indirectly affect the liver due to the release of muscle enzymes. To reduce the risk of liver damage and enhance the effectiveness of statins, it is beneficial to adjust lifestyle factors such as diet and exercise. Hicks valproic acid. Valproic acid is a medication commonly used to treat epilepsy and bipolar disorder. While it can be very effective, it also carries a risk of liver toxicity, particularly in young children and individuals with mitochondrial disorders. The medication works by increasing the availability of GABA, a neurotransmitter that helps stabilize nerve activity in the brain. However, this process can also put stress on the liver. The risk of liver damage is highest during the first 6 months of treatment, so regular liver function tests are essential during this period to monitor for any signs of toxicity. Certain genetic factors, such as mutations in the POLG gene, can make individuals more susceptible to this liver damage. Early detection of liver damage and prompt discontinuation of the drug are crucial for recovery. Folate supplementation might help reduce some of the toxic effects of valproic acid. Overall, while valproic acid is a valuable medication for managing certain neurological conditions, its potential for causing liver damage requires careful monitoring and management. Methyldopa. Methyldopa is a medication commonly prescribed to manage high blood pressure, particularly in pregnant women. While effective, it carries a risk of liver toxicity. Methyldopa helps lower blood pressure by reducing nerve signals that cause blood vessels to tighten. However, its long-term use can sometimes result in elevated liver enzymes, hepatitis, and, though rare, severe liver conditions such as hepatic necrosis. These hepatotoxic effects are believed to be immune-mediated, potentially leading to a condition known as autoimmune hepatitis. The good news is that liver damage caused by methyldopa is usually reversible once the drug is discontinued, but early detection is vital to prevent severe consequences. Patients with existing liver issues or those who consume alcohol are at a higher risk of experiencing liver toxicity from methyldopa. It's also important to educate patients on the early signs of liver damage so they know when to seek medical attention. Thanks for sticking with us to the end of this important video on medicines that can damage your liver. We hope you found this information valuable and now have a better understanding of how to protect your liver health while managing your medications. Remember, always consult with your healthcare provider before making any changes to your medication regimen. and ensure regular liver function tests if you're on any of these drugs long-term. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. Don't forget to subscribe to our channel for more health tips and insights. Stay healthy and take care of your liver.